Hi everyone, I'm Dr. Loharan. I'm the owner of Anatomy Chiropractic, and I know I've had a long hiatus from any type of video content creation that is like this, but I am back, and I thought I would kick things off with a case study of a patient in our clinic that had great success with Erchonia low-level lasers as well as our low force adjusting treatment protocols. So let's get into it. On May 7th, 2024, a 36-year-old female presented with constant pain and inflammation in her left neck, arm, and TMJ. She rates the symptoms as a 7 out of 10 pain, and it's getting worse. She describes it as tension, inflammation, and chronic feeling like she's clenching her jaw all the time. The patient had suffered from many traumas, including many falls off of horses. She was an avid horseback rider, polio player. She had a major fall off of a horse where she got whiplash in 2005. And prior to that accident, she also was involved in a number of fender benders as well. She currently has tinnitus and ringing in her ears, and she also is starting to get dizzy while she's doing her yoga practice. So let's take a look at her lateral cervical x-ray when she first came in. Here we have her lateral cervical x-ray, or the side view of her neck here. The biggest thing we want to look at are these lines back here. This is called George's line, and they're lines drawn on the back of each cervical vertebrae. And you can see from her, she has a nice smooth line here and then a little stair-stepping here that measures 1.69 millimeters. And then we continue to go down, and then she has another stair-stepping and another stair-stepping on the bottom two vertebrae here. These three areas where she has breaks in George's line are areas where she has ligament instability. So that means anytime she's moving her neck in any direction, up or down, left or right, any type of coupled movement, she's getting excessive shearing between the vertebrae. What that means is there's excess movement. And so when there's excess movement, the muscles in the neck are working really hard to stabilize her head because the weight of her head is very heavy compared to these tiny vertebrae here. When there's a lot of stabilization occurring, the muscles get really, really tight, and that can cause tension, inflammation, and it can also cause restricted range of motion as well. Based on her x-rays and her initial presentation, we recommended 1 month for her initial phase of care. During this month, we stabilized her atlas, upper cervical spine, and once that stabilized, we started working down the neck to create more stability down the neck. We also coupled these adjustments with Erchonia low-level laser therapy. We did 8 sessions, which is the recommended FDA treatment protocol for chronic neck pain. And after this 1 month trial of care, we re-x-rayed and did a re-exam to see her progress. And this is what we found. And here are her results after just 1 month of care. So this is the post x-ray here, and I've put the pre here so you can easily compare both images here. But the major thing is, remember George's line here. Now it is nice and smooth. We do not see any stair-stepping anymore in her neck. That means all of her ligaments have healed in her neck and she no longer has ligament instability. Next, the other big thing is we're looking at how far her head was forward too. You can see here that her head was farther forward. The number down here measures 20.9 millimeters, and now it is reduced to 12.51. So that means her head was like this, and now it is closer to better perfect alignment, which is ear over her shoulder, but now it is much closer to that ideal aligned position. You should be seeing a side-by-side screenshot right now of the x-rays, and while you're taking a look at those x-rays, I'm just going to quickly go over her re-exam findings. So after 1 month of care, she reported 90% improvement. She no longer has pain in her neck, shoulder, or TMJ, just some residual tension, which is very normal after just 1 month of care. And she reports feeling more free in her range of motion and feeling more aligned in her movements. Well, that's all I have for you today. I hope you guys enjoyed this video, and I hope that you guys enjoyed this new case study style of content that I'm going to try to create more of. If you have any suggestions, please leave them down in the comments below. And if you have any questions about anything that I went over today, leave them down in the comments as well, and I'll try my best to answer all of your questions. Okay, that's all I have for you today. Until next time.